Okay, well, good morning, everybody. Thank you for joining us and welcome to the JCM On Demand live event with our very special guest, Oran Kivity. Thank you so much for joining us. We are very excited for this highly anticipated follow-up event. We've had lots and lots of sign-ups, which has been absolutely brilliant. So I'd like to hand over and introduce you all to our guest speaker, British acupuncturist Oran Kivity, trained in Europe, China, and Japan. He's been in continuous practice since 1987, specializing in Japanese acupuncture and moxibustion methods and teaching internationally. He's written 2 books about the Ontaki warm bamboo method, a new moxibustion tool from Japan, and Oran is joining us today from Taiwan. So Oran, I would love to pass over to you. Thank you for being here with us today.
So thank you very much, Charlene, and welcome everybody. I'm not sure, it seems like a pretty international group. I know there's someone in India, someone in Indonesia, someone in Germany, someone in UK, and I'm of course in Taiwan. So it's nice to see everyone connecting through this new 2020 legacy, this miracle of Zoom. What we're going to do, I think I'm going to go straight to a PowerPoint because that kind of shows what we're going to do more. And I'm going to talk through the PowerPoint for a while, though you'll still see my face chattering away in the corner somewhere. And then I'll stop and we'll do a little bit of practical work. So let's see if I can share screen with you guys. Okay. If you're not sure what you're looking at here in this slide, on the left-hand side, you should be able to see a graphic of a piece of bamboo with moxa burning inside it. And on the right-hand side, there's a picture of Kivity Hirata, who we're going to be talking about. Before I start, I just want to say thank you to JCM, who've been very supportive of Ontaki and Balance Healthcare, who have and Charlene, who've organised this talk. It's been great. So what are we going to do today? I'm going to start off by talking about Kivity Hirata and the origins of Hirata zone therapy. Then I'm going to tell you a little bit about Ontaki. So I think many of you will know what Ontaki is, but some of you won't. And the book that I've just written is aimed at people who know nothing about Ontaki. So we'll just kind of pretend that you don't, even if you do. And then I'll talk about some treatment models and cases of ways to apply Hirata zone therapy with Ontaki. Well, with any story, there's a cast of characters. So I'll start with my story very briefly. I trained in TCM acupuncture from 1984 to 1987 in the UK. I also went to China a couple of times and was in a teaching hospital in Shandong. And I ran a busy London practice up until 2004. And I was a teacher on the TCM course at Westminster University. I got introduced to Japanese acupuncture methods around 1987, 88, 89. And I kind of converted or retrained in Japanese acupuncture styles. So I studied Manaka acupuncture and Toyohari acupuncture, and I became a teaching assistant to Stephen Birch. And I moved to Malaysia in 2004, and I've been there since up until last year. And I've been practicing there and developing Ontaki warm bamboo there. This is what happens if you forget to touch the space bar. So there you go. The animations come in. And just last year, during the pandemic, we moved to Taiwan. So I've just been in this southern port town of Kaohsiung for the last few months. Let's talk about Kivity Hirata. So he died in 1945. He died young. He was killed in the Second World War. He was very much an idealist and creative in many areas, including martial arts and he developed a whole load of postures and for health, and he's regarded as an influence in some styles of jiu-jitsu. But he was also a medical student, and as a medical student, he became very critical of Western medicine. I mean, it's an interesting kind of cycle in Japan, that Japan was a feudal society in the 19th century, and it had been isolated for 200 years. And then it kind of flipped, and they started to import Western culture, Western technology, Western science. Basically, at the point of a gun, the Americans forced them into the modern world. And then there was this sense of national shaming, and they became interested in everything modern. So everything traditional went out the window. And then in the early 20th century, there was a kind of rebellion against that, and people started going, "Hey, what's going on? You know, I don't like all this scientific stuff. What about traditional acupuncture?" And that was certainly a movement called Back to the Classics. Now, Hirata was not part of that movement. He wasn't ostensibly an acupuncturist. He was a medical student, but he was very critical of Western medicine. And he wanted to create a treatment system that fulfilled two conditions that Western medicine did not. So the first of all, he wanted it to trigger the body's own healing responses. So surgery and drugs were not doing that. So he wanted to have a system that marshaled the body's own resources to heal itself. So a very holistic idea, which as acupuncturists we're all familiar with. And he also wanted it to empower the public to treat themselves at home. So his system had to fulfill these two criteria. Now, his model of disease was strongly influenced by traditional East Asian medicine, the team idea of heaven, humanity, and earth, Tianrenji. And he thought that basically we exist, just like in the model in acupuncture, between heaven and earth. So yang influences play on us and yin influences play on us. And the interface of these different forces on us is the skin. So he thought that, yeah, the skin is the interface between human beings and the natural world. And because that's where disease enters, then that's where reactions take place. And so his whole treatment model was designed to stimulate the skin. And his treatment modality was stimulating the skin with heat. So originally his therapy was called hot needle therapy. And he developed something called the Shinryoki, which translates as mind therapy device. Shin is mind, or Shen. The Shinryoki. So it's basically a conical device filled with alcohol, burning alcohol, which you tapped on the skin. And so it created a very focused kind of heat. There's a classical picture of it from an early book. So it was asbestos lined, and you filled it up with alcohol, set fire to the alcohol, and then you tapped on it. So obviously that wouldn't be considered very safe. And Junji Mitsutani from the North American Journal wrote, I think just 2 or 3 years ago, about trying it out on himself. I actually tried this device out on myself. I didn't reference Hirata's zones, but instead just treated tight areas with the mind therapy device. The feeling of the treatment was brief, stinging, sharp sensations. The next day, there were many small burns, about 2 millimeters across. So you can see this was quite a strong kind of heat treatment, and we wouldn't want to use something filled with burning alcohol lined with asbestos that leaves blisters on our patients. That might not go down too well. Now, as I mentioned, Hirata died in 1945. But there was another character in the story who took up his work, which was the hugely influential acupuncturist Yoshio Manaka. Dr. Manaka combined scientific research skills, because he was a medical doctor, with a fascination for traditional methods of healing. So he studied Hirata's books, and he enthusiastically adopted Hirata's methods. And eventually he published his own book about them in 1982. And he integrated the Hirata zone treatments into his own protocols. And he even developed his own heat application tool, which was called the Tenshin Q, which is like a heated spiked roller. So a kind of device, that electronically heated roller that you rolled up and down the skin or tapped on the point. Manika's influence has come to the West through my own teacher, Stephen Birch. Stephen is a British acupuncturist, author, and trainer who collaborated with Dr. Manika in the 1980s. And he wrote Chasing the Dragon's Tail, which was for Dr. Manika, with Dr. Manika's input and guidance. So Chasing the Dragon's Tail has the first early mentions of Hirata zone therapy. I think Hara Diagnosis as well, that Stephen wrote with Kiko Matsumoto, also talks briefly about Hirata zone therapy. But Steve's classes don't cover HZT, Hirata zone therapy, in any detail. And I think this is principally because there was no heat application tool available for people to work with. But when Steve first read about my own work with Ontaki as a very mobile heat application tool, he encouraged me to study applying Ontaki with the Hirata zones. The conversation went something like this. Hey, Oran, I've got this little idea. Why don't you just go and research Ontaki for the Hirata zones? It won't take long, honest. And I thought, uh-oh. But anyway, it became something of a mission to decode these, the work of these two great masters. And Steve also very generously gave me an unpublished chapter that was supposed to have gone into Chasing the Dragon's Tail, that never went in for reasons of length. So thank you, Stephen. What is Ontaki? It's a small piece of bamboo filled with moxa wool. It acts as a very light and mobile moxa box, and it's inherently rhythmic. You can tap with it, you can roll with it, you can press with it. It's very easy to apply, and it's very safe to use. So it's a really a very novel moxa device that was really little used in Japan and is probably less than 50 years old. The earliest mentions of it are probably in the 70s. So something quite new within the timeline of acupuncture. It's really the new kid on the block. I got very interested in Ontaki about 11 or 12 years ago when I was first introduced to it. And my first book was all about the applications of rhythmic moxibustion using Ontaki, and ideas from various Japanese masters. Now, I went through a similar thing that in my first book, I had written a lot about the Hirata zones, but those chapters made the book way too long. So I took them out and put them into a second book, all about the Hirata zones. And this is also a standalone book. It assumes that you haven't read the first book and that you're just curious about Hirata zones. So what are the zones? Basically, Hirata came up with a holographic system, and he came up with a mapping on the body of this system. So I'd like to try and define what a holographic system is to those of you who think they're not familiar with it. But actually, I think all of you are familiar with holographic systems, because probably 99% of you will have had a foot massage before. So a holographic model it's a three-dimensional image of a given object, which contains the information of the object in itself and in every part of itself. So each part of the body is a microcosm of the whole. So the most famous holographic model in the West is reflexology. So this idea that the big toe is level or corresponds with the level of the head, and the two medial surfaces of the feet correspond to the spine, and kind of a little bit down at the ball of the foot corresponds to the shoulders. So this idea that the foot reflects the whole body and all the information of the body is encoded just in the foot. Another very famous holographic model is ear acupuncture, developed in the 1960s by Nogier. So the idea is that the lobe of the ear reflects the whole ear shape is like an upside down fetus in the womb. So the lobe of the ear reflects the head, and the outside helix reflects the spine, and the internal organs are inside, just like a baby hunched up in a fetal position and upside down. But in actual fact, the back shoe points in acupuncture are a holographic mapping. And they're a holographic mapping from the classical texts. So you know that bladder 13, bladder 14, bladder 15 reflect those organs in the upper jiao, the lungs, the pericardium, the heart. And those back shoe points in the middle part of the body reflect the organs in the middle jiao, in the middle part, like the liver and the spleen and the stomach. And those back shoe points in the lower part of the back and around the sacrum reflect the kidney and the bladder. So the back shoe points are a holographic mapping on a one-to-one scale, whereas the ear microcosm or the ear microacupuncture system is not on a one-to-one scale. You have to be very fine with your needle, and so you can find things very easily on the ear, or you can skip around the body very easily. So what's interesting about Hirata's mappings is that they were horizontal. They consist of 12 zones that repeat in 6 different regions. So those regions are the head, the face, the neck, the arm, the torso, and the leg. And those 12 zones will repeat in each of those regions. So I'm going to talk to you now about 2 of these zones, 2 of these regions, which is the arm and the leg. So let's try and visualize this. Let's look at your arm, and we can see that there are 12 zones on the arm. It looks like from my slide that I've cut off the lower bits a little bit, so apologies for that. Too late for me to fiddle with that now. So basically, yeah, there are 12 zones, and the first zone, zone 1, is called bronchi, and the next one down, number 2, relates to the lungs, and the next zone relates to the heart, and the next zone relates to the liver, etc. So I'll read them out: gallbladder and the exocrine gland of the pancreas, and zone 6, spleen and the endocrine gland of the pancreas, so insulin production. Zone 7, stomach. Zone 8, kidney. Zone 9, large intestine. Zone 10, small intestine. Zone 11, which you can't quite see, is bladder. And zone 12 relates to the reproductive function, the reproductive organs. So uterus, ovaries, genitals, internal and external genitals. So it seems like this idea of horizontal zones is kind of very new and weird. Well, you know, all the meridians we know are vertical, but these zones are horizontal. But as I kind of got into studying them, I realized that the horizontal zones have been hiding in plain sight, and Hirata was simply the first to identify them. So if we take the inner and outer bladder lines on the back, then you'll see that there are points that have very similar functions at the level of bladder 13, for example. You have do12 on the midline, you have bladder 13, and then you have the outer bladder points. So you have a horizontal chain of acupuncture points that have a very similar function. You could say the same with Mingmen, do4. You could, and then bladder 23 and bladder 52, the will, I can't remember the Chinese name. So there are horizontal horizontal chains of points all along the back, and these go all the way down from top to bottom. So actually the idea of horizontal zones is not so strange. Interestingly, I remember John Tyndall, who was the practitioner who brought the NADA protocol to the UK and taught a lot using the NADA protocol on the ears. He spent some time on a Navajo reservation and he was teaching them acupuncture. And they had their own horizontal system of points. And they started to talk about needling points like lung 3 and Ren 17 at the same time, apparently with very good effect. So Hirata may have been the first to talk about these, but maybe not the last. So I'll talk a little bit more about the points on the arm in a second, but I just want to show you these points. Hopefully you can see a laser pointer here. So this is the head zone. And we have points going 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 along the head. This is the neck zone, which is contiguous with or adjacent to. And here the points come from the bottom. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 up to here. And here on the torso, they go from top to bottom. So what we call a normal image going from top to bottom, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, etc. And on the leg, a reverse image, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Now, I don't expect you to learn all of these now. That would be very difficult. But what I would like to do is to talk about the landmarks on the arm. And so let me just talk about the arm now briefly. We can divide the arm up into 3 units. So the upper arm, the forearm, and the hand. And there are 4 zones on each of these units. So let's talk about the upper arm first of all. The same kind of rules that we use when we're finding lung 3 and 4 apply. So basically your first landmark is going to be the axillary crease. And if you draw a line outwards from the axillary crease, that gives you the demarcation point between zone 1 above and zone 2 below. So to find this on yourself, if you just experiment, just hook your finger under your armpit and come out laterally, and then you'll just be able to put your hand on the deltoid, the capsule of your shoulder. That is zone 1. And if you slide your hand down, that is zone 2. The next thing is to take that axillary line and the transverse cubital crease, the crease of your elbow, and divide that area into 3. So the remaining zones on that upper part of the arm, zones 2, 3, and 4, are just there. So you just can find those 3 zones. So 1, 2, 3, 4. Now, to find the points on the forearm, it's very easy. You find the wrist crease and you find the elbow crease, and you divide that area into 4. Yeah. So you can see on the diagram that zones 5, 6, 7, and 8 are just evenly spaced along the forearm from the transverse cubital crease, the elbow crease, to the wrist. And finally, you want to find the wrist crease and the line created by your knuckles. And that will give you the first 2 zones, zones 10 and 11. And then from that line at your knuckles, halfway down your hand, will give you the remaining zones 11 and 12. Now, just as a quick experiment, I'd like you to tap along with me. So basically, I'd like you to use 3 fingers as a marker. And I'd like you just to touch zone 1 on your shoulder. So you can just tap that. So that's zone 1 belonging to the bronchi. Now, if you slide your hand down a bit, just below the axillary crease, that gives you zone 2. And then if you slide your hand down a bit, that gives you zone 3. And then if you slide your hand down a bit so that your finger is resting on the elbow crease, that gives you zone 4. So the elbow crease is a very good landmark because zone 4, the liver, is above it, or proximal, and zone 5 is just below it. So slide your finger down just below the elbow crease, that gives you zone 5. And then you can just divide the rest of your hand, your forearm up, and tap downwards, and you should have zone 5, 6, 7, and 8. I'll do that again, zone 5, 6, 7, and 8. So very, very easy. Now, on your hand, again, you can just use your fingers, just tap here in the upper part of your hand, and then go down to the knuckle. There's zone 10, there's zone 11, 11, and 12. So 9, 10, 11, 12. Now, as an acupuncturist and as a Westerner, I wanted to have very precise landmarks for these zones. But when I went to Japan and I interviewed contemporary practitioners of Hirata, I got the Asian face that said, "You're asking too many questions." Because there's a difference between doing acupuncture with a very fine needle and doing treating zones. When you do acupuncture with a needle, you have to be very accurate with your point location. But when you're using a heated roller, like Dr. Manika's spiked roller device, or when you're using Ontaki, or when you're using the kind of devices used in contemporary practice in Japan, you don't have to be that accurate. It's the difference between an artist who's drawing a fine art painting with a small paintbrush and a decorator who's painting a room with a roller. So the zones are quite a forgiving system. And if you stray over the line between the heart zone and the lung zone, well, that's okay. The body's not going to be angry with you. I mean, the most important thing is, we'll see in a minute, is to look for reactions. And it's those reactions that you want to treat. So finding the zones on the arm is a very simple matter. You just kind of basically go, well, that's 1, that's 2, that's 3, that's 4, that's 5, that's 6, that's 7, that's 8. It's that easy. Now, the zones on the leg are exactly the same. They're going to be 4 on the thigh, 4 on the calf, and 4 on the foot. But this time, the order of the zones is reversed. It's what we call a reverse image, or what Dr. Tan, Chinese acupuncturist, calls a reverse image. So normal images go from top to bottom, and reverse images go from bottom to top. So we're going to divide the foot up into segments. So where the ball of your foot is, so spleen 3 and bladder 65 for acupuncturists in the group, that will give you one delineation between zones 1 and zones 2. And if you just kind of imagine a guillotine coming down in front of your ankle, like a sagittal plane, that gives you zone 4. And then zones 2 and 3 are just divided equally between those 2 lines. So your landmarks are the front of the ankle, the anterior part of the ankle, like a sagittal plane, and the line of the ball of the foot. And then just above the ankle, just superior to that, where liver 4 is, the acupuncture point liver 4, that gives you the superior part of zone 4. So always remember, liver 4 is in zone 4, so it's easy for me to remember where it is. And then your remaining landmarks are the knee crease and the inguinal joint and the gluteal fold. So you just create 4 even spaces between those, in those upper part of the leg and the lower part of the leg. So let's do the same tapping thing. What I'm going to do is just stop the screen share for a minute so I can see your faces. And I'd like you to just start tapping on your foot, if you would. if you can bend your foot up and just use 3 fingers to find zone 1. So that'll be somewhere around your big toe and coming up to the ball of your foot. And then 3 fingers to tap on zone 2. That's going to be just posterior to the ball of your foot. And then come a little bit posterior, that's zone 3. That's just coming up towards and approaching your ankle. And then your ankle bone itself is zone 4. Then you can tap above that. So you're tapping kind of around above the medial malleolus. That's zone 5. And just keep going up until you come to 6, 7, and 8. 8 is kind of the stomach 36 spleen 9 area. And then above that is zone 9, 10, 11, and 12 coming up right into your underwear. So let me go back to that screen share so you can see. Now, I'd like to share something interesting about the zones, particularly the zones on the anterior part of the thigh. If I flip to the next slide. Oops, can I flip back? You'll see that there are various zones on the lower part of the back. So L2, lumbar 2, is the junction, is the demarcation between zones 8 and 9. So often people have back pain, lumbar back pain around L2, so zones 8 above and zone 9 below. And what you will find very often is that the upper thigh gets tense when there's back issues. So this area, zone 8, 9, 10, and 11, can be a very good diagnostic area for back pain, that if you're palpating people's legs and you notice some reaction on one side or the other, it's a very easy diagnostic step to say, oh, are you getting low back pain on this side? So it can be very informative as a diagnostic tool. Okay, I'm going to talk about models of treatment, and then I'm going to give you some case histories. So in my research, I basically talked about the way that Hirata treated when he first started, which is what I call basic HZT. And then Dr. Manaka came along 40 years later and made things a little bit more complicated. In fact, when I went to the International Thermotherapy Association in Japan, one of the first things they said to me was, Manaka made things too complicated. I don't think he did. I think he found a way to be more economical. And then there are more complex or contemporary versions of HZT that we can talk about. But what I'd like you to come away with today is basic HZT, because this is something that is really easy to learn and really easy to teach to people, and therefore can be used to empower our patients to treat themselves at home. So basic HZT, or Hirata zone therapy, is basically a medicalized model using only the zones. So I'll talk about it in more detail. An intermediate HZT, which was more Manaka's thing, integrates channel theory into the zones. And Manaka had all sorts of ideas about how the channels can be used together with the zones. And complex Hirata zone therapy is basically anything contemporary. So using channel pairings, integrating yin-yang theories and polarities such as left, right, upper, lower, front, and back. Now, of course, I can't teach you all these things in this short time, but I think I can teach you how to use basic HZT because it's so easy. And to understand how to apply the zones, we can think about auricular therapy, which was developed in the 1960s by Nogier and then adapted in China with a Chinese version. So there are 3 selection criteria in ear acupuncture. So the first one is using Western medicine. as a tool to decide where to treat. So basically, if there's a liver problem on the ear, if there's a liver problem, you treat the liver point. If there's a kidney problem, you treat the kidney point. If there's a heart problem, you treat the heart point. So for basic Hirata zone therapy, this is the same criteria. For liver problems, you treat the liver zone. For kidney problems, you treat the kidney zone. And for heart problems, you do the same. So very, very easy. So if someone comes to you and says, oh, I've got problems with urination, or I've got bladder problems, you can choose to use the bladder zone, or you can choose to use, if they've got nephritis, you can choose to use the kidney zone. So a very simple selection criterion. Now, the next one is coming from traditional East Asian medicine theory. So basically, we know that in acupuncture theory, different organs affect different tissues. So for example, the liver opens into the eyes, or the kidneys affect the memory, or heart issues can affect sweating, or lung issues too. So you have to decide which is behind it. So you can use team theory to inform your choice of zones. And I'll give you an example of that in a few minutes of when I treated someone with eye problems. Now, the last thing in ear acupuncture is the location. Very often in ear acupuncture, people say, oh, well, you've got problems in the lumbar area, so I'm going to do the lumbar spine area. And so we can think exactly the same way for the zones, which is that if there is a pain in a certain zone, so for example, I talked about lumbar pain just above and below L2, so zones 8 and 9, then you can look at zones 8 and 9 in all the different regions and see whether there are reactions. And often as not, you will find some reactions in those zones. So you can just treat the same zone in a different region. So location is a very useful idea. So for lumbar problems, treat the zones that traverse the lumbar area. For shoulder problems, treat the zones that traverse the shoulder area. So 3 selection criteria: Western medicine thinking, so medical thinking, traditional East Asian medicine thinking, and location. Those are your 3 ways to select the zones. Now I'm going to give you 3 case studies. So the first one was in Kuala Lumpur. Guy, 32 years old, with a persistent cough and occasional lower backache. He was generally healthy and robust, and he developed what he called a mystery intermittent cough that he was unable to shake. So generally he was quite healthy and robust. And on questioning, the timing of his cough suggested that it was actually nothing mysterious. It was to do with what we call the haze in Kuala Lumpur, which is a yearly cycle of air pollution. So, right. He also developed some intermittent lumbar pain. So Hirata's prescriptions for cough typically focus on zone 1, the bronchi. And according to the location of the back pain, the affected zones were 9 and 10. So when we palpated around the leg, there was marked tension at zones 9 and 10, basically on the stomach channel above the knee, and a few slightly rough patches on his chest at zones 1 and 2, which are around here. So we tapped on those with Ontaki, on the deficient areas on his chest and upper arm. We just tapped with Ontaki until the skin felt warmer and more even. And then we worked on his thighs with the side of the bamboo, just pressing and rolling and knocking until that tension on the anterior thigh was relieved. And after he turned over, we tapped on the upper back, identifying and treating more dry and rough areas. So it didn't take long, maybe about 10 or 15 minutes, and no other treatment was given. So following the session, he reported immediately that the stiffness at the back of his legs and his knee pain, which he hadn't disclosed, felt much better, and this maintained. And the cough also cleared for a few days, but when the pollution got worse at the end of the week, it came back. So we couldn't help with the pollution. The next case is a female, a woman around 30 years old who had lumbar and buttock pain and abdominal distension. So she'd been coming for back pain for a few weeks with acupuncture, and she'd been getting better, but she'd had a long flight home, and she had a relapse coming home from a conference. So according to the location of the pain, the zones were 9, 10, and 11 on her back. So above L2, below L2, and over the sacrum. And just as a quick mnemonic, zones 10 and 11 go over the sacrum. So if you misspell the number 11 in your mind, you can say, to treat the sacrum, choose zones 10 and 11. So 11 and sacrum is your mnemonic. So 10 and 11 is sacrum, 8 and 9 is lumbar. So yeah, those were the locations. And then her abdominal distension relates to spleen and stomach, according to team theory. So when I looked at her thigh, once again, marked tension at 10 and 11. Bamboo was applied, pressing and rolling on the right. And after the muscles released, which didn't take long, a couple of minutes, her left leg also felt much more relaxed. So we did the same thing, but just for a shorter time, just for half a minute. After this, we got her to walk around, and she said, oh, the pain was much reduced. So then we worked locally on the back of, then we worked on the back of both hands. So zones 10 and 11 on the hands. And after testing once more, the pain was completely gone. And then we got her to lie face up in supine position. And we worked on zones 6 to 10 on the abdomen from the midline out towards the lateral aspects. So those whole horizontal zones. And then we finished with local rolling on the back, just working where the pain was as well. By then she was very relaxed, and we finished just with a very light Toihari style root treatment. So you can see this case is more to do with location of pain. And finally, a male, 32 years old, sudden onset of redness and itchiness in his right eye, which was beginning to close up. So according to team theory, the liver opens into the eyes. So we did zone 4, which is the liver zone, on the head, the arm, the back, and the legs, simply tapping each zone for about 1 minute. And on the limbs, we just did the right side only. On the head and the back, we did both sides. So the eye infection reduced in intensity within minutes, and it had completely cleared up within 2 hours. So just tapping the liver zone with Ontaki. No other treatment was given. I'm not going to teach you very much about intermediate Hirata zone therapy, but I'll just say that I'll say a few interesting things about it. Dr. Manaka came 40 years later, after he came into this work 40 years after Hirata's death. Hirata had already talked about meridian lines, but because he was slightly medicalized, he didn't want to call them meridians. Instead, he called them flexion lines and extension lines. And he started to use the meridian system, which is basically the meridians by another name, in his own way. But what Dr. Manaka felt was that there's something lacking from traditional acupuncture theory, because all the meridians in the body, apart from the daimai, are longitudinal. They run along the arms, and they run along the legs. So they all go top to bottom, bottom to top, and only one of them goes horizontally. So he felt that if you draw, and you'll see from this illustration here, if you draw the meridians on the arm, and then you draw the horizontal zones on the arm, what you've got is a three-dimensional model of the body. It's like a very primitive computer rendering of an arm. So he thought that integrating these two systems together gave you a much more three-dimensional way of viewing pathology in the body and of palpating and of finding reactions. And he said that the most important thing to treat was not the whole zone, but where the relevant meridians cross that zone. So in other words, just look for that bit where the meridian is crossing over into the zone that you want to treat. Now, we interviewed a practitioner in Japan called Yokoyama Sensei, who has written his own book on hot needle therapy and Hirata zones. And he says that he believes that the whole zone system is an extension of the horizontal quality of daimai. So the daimai in traditional thinking goes around the belt on the torso, and its influence can be seen on the arm and on the leg in the horizontal banding of the zones. So I think that's a very interesting observation. I won't talk about any cases or treatment because otherwise you'll have steam coming out of your ears, but we'll go to the next slide and I'll talk a little bit about contemporary HZT. For those of you who read my first book, you will have seen that I used Ontaki for pain relief using holographic models developed by Dr. Richard Tan. And Dr. Tan used a lot of channel pairings. So what I found in my own work is that you could swap out, a bit like the motherboard on a computer. You can take out a component on a computer and put in a different piece of hardware. If you take out the model, the holographic models from Dr. Tan, and you swap in the holographic models from Hirata, then you've got a new system for treating, which uses channel pairings, just like Dr. Tan does, but has all kinds of new possibilities because of this horizontal modeling. So I've done a lot of work using Dr. Tan's channel pairings with the horizontal mappings of Hirata. But basically in complex or contemporary Hirata zone therapy, anything goes. So you can integrate it with what you already know about acupuncture, or you already know about shiatsu, or your own healing styles. So there are people who've been trying to integrate this kind of thinking with Sa'am acupuncture, for example. So anything goes, basically. And the other thing that I did is that I integrated Dr. Manika's meridian frequencies, tapping with a metronome. So these are things that can be very useful. And so I would say complex HZT, your imagination is the limit. It doesn't have to be what I thought of, it can be what you think of as well. Now, what's the value of all this in the clinic? I think there are various things that we can say that this is useful for. It's a very good adjunctive treatment. So in other words, you do what you like to do, you treat in the way that you normally treat, and then you add some Hirata zone therapy at the end or in the middle of your treatment in the way that I was describing with the 32-year-old woman with back pain, where I did Toyahari as part of the workflow, but also I did Hirata zone therapy. So it's an adjunctive treatment. It can be an additional treatment. Or as in the case of the guy with eye problems, it's a treatment in itself. You don't need to do anything else. You just treat alone using the zones. But for me, the most exciting thing about Hirata zone therapy is that it empowers patients to continue their treatment at home, because it is actually a very simple thing to teach people to use bamboo. It doesn't take long to model it, and you'll see, I think, in my last talk for JCM Balance, I showed how to load and light bamboo, and the talk didn't take long. It doesn't take long to show someone how to fill up a bamboo with moxa, set fire to it, and to tap it on their arm. So you can empower your patients to continue their work at home, which is going to create momentum, because you can say to them, look, I just want you to do the kidney zone on your arm and on your leg every day for the next week, and then come back to me next week, and let's see how things go. Or I want you to do this on your daughter every day for the next 2 weeks. Just treat the lung zone and the bronchi zone because of your daughter's asthma. So you can give these kind of treatments to your patients. So you can give them bamboo, you can give them moxa, and you can create this new empowering method for them to continue work at home without having to know anything about meridians, without them having to know anything about yin yang theory. You can just say, look, I just want you to tap here every day. So it's a very empowering thing to do. Now, some of you have asked me what the book cover is about. Basically, it's referring to Hirata's work on posture. He did a lot of work on posture where he said that stretching his flexion and extension lines, in other words, the meridians, he developed all these postures for strengthening the organ function through posture. So we modeled that for our book cover. It's 90 years since his first publication. And as I've been working on this quest, this mission that Stephen kind of triggered, I've discovered this lost art of dermatome moxibustion. And personally, I've become infected by his idealism, this idea that we can give patients something to do at home that is easy and simple. I've thought very much about authenticity, is what I'm practicing now authentically Hirata? And I have to say it's not. It's something that has been repurposed for contemporary practice because, of course, we don't want to use a piece of metal filled with burning alcohol. Instead, we can use Ontaki. And there are all kinds of considerations that apply to us in the 21st century that didn't apply to him 90 years ago. But I think for me, the most exciting aspect of Hirata's own therapy is the sense of empowerment, the sense that he wanted, this Shinryoki was distributed free with his first book, and it was a runaway bestseller. It was reprinted many, many times during the first month. So it became like a big hit in Japan, people tapping at home with the Shinryoki. And I think only history and his death and politics and the waves of fashions really, and the fact that we couldn't get these things in the West, I think those things have stopped us from finding this knowledge. So I think it's a really amazing therapy, and thank you very much for listening.
Thank you so much, Oran. That was really interesting. Are you happy to take a few questions?
I am.
Perfect.
How are we doing for time? We've got about 30 minutes, is that right?
Yes, about 30
Okay,
minutes
great.
exactly. Yeah. So we do have a question within the chat function. I think it was because your slide slightly cut off some of an image. Somebody has asked, what are zones 11 and 12 in terms of which organs are they?
11 is the bladder, and 12 is the reproductive zone.
Thank you very much. There we go. And not a question so much as a comment from Philip Armitage, and he said, and please excuse my pronunciations here, but he said meridian sources are medical or Taoist. There are multiple Dai Mai meridians according to the new Taoists, several on the limbs, trunk, and neck.
I'd like to chat to you more about that, Philip. We can correspond later. Thank you for that. Yeah, that's very interesting.
Okay. We do have a question here from Vina Stevenson saying, thank you, first of all, for your presentation. It was very clear and really fascinating. Are there holographic correspondences with the front mu points? Again, I might have pronounced that incorrectly. And also with the skin dermatome map. Given that we live in the evidence-based era, has there been much of this type of research?
Right. So the first question, I'll answer the second question first. There's been very little research on Hirata zones. So this is something for us to do as a community. Um, it's, yeah, so Manika obviously was a medical doctor and very enthusiastic about it and adapted these things very much. But for all this stuff, we need to go back and start researching. As I was researching them, I found that there was a lot of discrepancy in the actual where the mappings are. For example, early Hirata would say one thing, later Hirata would say another thing. His biographer Kume would say another thing, and Manika's mappings, for the most part, fitted them, but there were variations. So I've tried to kind of thread this as I've done the research, particularly keeping it consistent with the landmarks that have been developed by Dr. Tan, which I found work very well. So, for example, the navel and L2 being mirror images of each other. So I think that there is some correspondence on the torso with dermatome mappings, but for as far as the legs and the arms are concerned, we need to research them and to test and prove them for ourselves. I think it's a really good question. And the last part of that question was, are there any correspondences with the front mu points? So Ren 12 is another landmark that's very useful because above it is the spleen zone and below it is the stomach zone. So that's one correspondence. Thank you for that question.
Thank you very much. We've had another question here from Boris Beckers. Can you use the zones as a diagnostic tool? Means finding in the zones give you a hint to the show.
Okay. So Boris, you're talking in terms of Toyohari. I think that would be something to play with. They are used diagnostically. So very often in not just in Toyohari, but also in TCM, we get stuck for a diagnosis. Like in Toyohari in particular, we say, oh, this is a lung show, or is it a kidney show? And we can't decide which, or is it a spleen show? And meaning, what is the primary weakness in the five element system? But also within TCM, we have the same kind of problem where we go, is this liver yang rising? Is it, what is the most important thing to treat? So I feel that the zones can be very useful in that regard because they can be used diagnostically. So as I was talking earlier, you can palpate on the upper thigh or along the stomach and spleen channels and get a real sense of which of those zones are tight. And that will give you ideas about what to treat. Dr. Manika said that the reactions on the zone are of critical importance. So particularly where a channel will go across a zone, then if you palpate along there, that will really give you an indication of whether or not to treat. So Boris, in answer to your question, there are practitioners in Japan who use the zones diagnostically. I use them diagnostically all the time because I always palpate the arms and the legs. It's the first thing I do. And that gives me a sense of where there's tightness. And when I start to notice those things, that starts to point me in a certain direction and a certain line of questioning as well. There's been no research yet to see how we could integrate that with Toyohari, but there's lots of time for us to do that. So thank you.
Thank you.
Next question.
Thank you, Oran. I have a question here from Marek. Would you include the 6 division pairings as a way of looking at the relationship between different zones? Also, do acute or chronic symptoms show up more on arms or legs?
Again, I'll answer the second one first. This is the one I remember. I can't tell you yet whether things show up, where things show up for acute and chronic. My experience is not long enough. I think that's a very interesting question. Yeah, so I think it might be that acute things show up on the neck more, but that's just, I can't say that definitively. But when I palpate around the neck, sometimes I notice things manifest very quickly. And the neck is an interesting area because it's adjacent to the face zone, and it's adjacent to the head zone, and it's adjacent to the torso zone. So it's a kind of gateway of, region. So the face region, the head region, and the torso region all meet at the neck region. So it might be that the neck region is a particularly dynamic or important reactive area to look at. Now, going back to your question about 6 divisions, I'm not sure I really understood the question. Are you saying 6 division pairings, as in channel pairings, are they a useful system to use? Is that what you're saying?
That was my question, Oran. Yes, I wondered, if you have a sort of Tai Yang diagnosis, would you then find, bladder, small intestine, which zones were showing up more? Would that be a way of having another kind of model, or that just make it too complicated?
Okay, so you have to remember where Hirata came from, which was he came from a medicalized model. So he's talking about the zones relating to the function of the organs, rather than the kind of that progression of fevers, for example. So no, I don't think I would use the progression of fevers or 6 divisions in that particular way. But I certainly use channel pairings all the time. So if someone has a problem with sciatica and it's affecting zones 11 and 12, 10 and 11, let's think about the sacrum. So 10 and 11 zones go through the sacrum. Then, I would look at treating small intestine maybe on zones 10 and 11, as well as to affect the bladder channel if it was bladder type sciatica. So I would use those relationships in that way. Thank you.
Great. Thank you.
Thank you, Oran. Another question from Cal. When palpating, are areas of loose or decreased sensation looked for, or primarily areas of tightness?
Okay, that's a great question. Basically, in Japanese acupuncture, there's this concept of which we can call abnormal tissue findings. And abnormal tissue findings can mean anything, so either excess or deficient findings. So excess findings are the kind of things that you find, if you palt your gallbladder 21, the top of your trapezius, if you've been working on a computer for a long time, it will feel tight and hard and painful on palpation. So that's an excess finding. But zones can also be palpated for deficiency findings. So you might find that they feel cold, or they might feel moist, or they might feel sticky, or they might feel hollow or empty. So those are all reactions that can be changed with treating with Ontaki. So if they're deficient, then you're going to do very light kind of Ontaki to warm them up and to bring more chi and blood into the area. Whereas if they're excess, you might do slightly stronger techniques like rolling or tapping or knocking to just try and disperse the tension. So you can use Ontaki in a very flexible way, depending on what you find. But yeah, definitely you want to look for all kinds of reactions, not just strong, tight reactions. Thank you.
Thank you. Another comment from Philip saying, if I understand correctly, we can use the Hirata zones in a Western or team style, treat liver for the eyes or liver function.
Yes, that's correct.
Okay.
Yes, that's absolutely correct. So if a patient comes to you with hepatitis, then you say to them, I want you to do the liver zone every day. Here's your Ontaki, go away, do the liver zone. And if someone comes to you with eye problems, you say, the liver opens into the eyes, so we're going to treat the liver zone for that reason. Or if they have ankle pain, they say, look, I want you to do the liver zone because, that's where your pain is. So we're going to do the liver zone on these other regions to help your ankle pain. So you can use it from those 3 criteria of Western medicine, traditional East Asian thinking, and location.
Thank you. Another question in your experience in East Asian countries, have practitioners been in a position to treat at all in the COVID-19 circumstances? And if so, are people treated for it according to this system?
Okay. I can't tell you what's going on in Asia as a general rule, because in terms of treatment for acupuncturists. In Malaysia, where I was, we were kind of switched on and off in terms of our ability to practice. So at first we could, then we couldn't, and then we could again. So it just depended on which stage of lockdown that we were at. But currently, acupuncturists in Malaysia are practicing. Here in Taiwan, they're definitely practicing because there's no community spread in Taiwan. In Japan, I don't know what the restrictions were for practitioners, so I can't answer that. But they have had extensive lockdowns, and I don't know. There's only a very small proportion of people who are doing Hirata type therapy in Japan. So it's not like it's a huge, big movement in Japan. It's almost like a lost art. So the equipment to do Hirata, those heated rollers retail at something like $900 per set. So that's not practical. So that's why I think that not really in keeping with Hirata's vision of making this a people's medicine. That's why Ontaki is so great, because it just costs, pennies. You can go out and make your own Ontaki from a garden center. Thank you.
Thank you. Catherine asks, where can we buy the bamboo and moxa?
You can buy them from JCM Bookstore. So from the JCM Balance store. If you're in Europe, you should be able to get them from there. And my website as well, orankivity.com, also sells them. But at the moment, I can't send from Taiwan to UK because there are no flights. They've been cancelled due to the pandemic. So I think Portugal and Spain I can't ship to either, but I think that JCM Balance can. I was talking to Jim, who runs the shop. He was saying he's having a lot of problems shipping stuff to Europe. So yeah, basically if you're in the UK, you're good. Just order from here. And if you're in Europe, if you're lucky, you'll be able to get it from JCM Balance or from my own website, orankivity.com.
Thank you. And what I can do is in a follow-up email, I can send everybody a link to where you can purchase bamboo and moxa in regards to the JCM. Right. Another question for you, Oran. Do vaccination scars on the arm have an impact on the zone or other scars elsewhere?
That's a really good question. And I think there's been no research on that. I've not come across anyone talking about scarring on the zones in what I've read or who I've interviewed. I think the general thinking about scars is to look at them as whether they are active or not active. So very often with C-section scars, they heal up really well, and you know there's nothing going on there. So they become pink and soft and loose on palpation. But with some scars, it's like there's a worm underneath them. It's like you feel like an excess when you palpate. Or there's discoloration, like purple or redness, and that's another sign of a reaction in a zone. So I think as far as scars are concerned, from my own experience, I would just look at the scar to see whether it's active or not. If it's active, it will be discolored, raised, tender, itchy, or there'll be some numbness all around there. So that means the scar hasn't healed up. And then I would treat it. And if it's in a zone, then I think definitely then that's going to have a systemic effect. But if the scar is kind of really looking good and feeling normal, then I don't think it would be significant. That's my opinion, but I haven't seen any research.
Thank you. Thank you very much.
Hi, yeah, I'm trying, but I'm having trouble getting my camera back on. I don't know why. I just wanted to to clarify that with the zones, the area that you're going to treat, because there are multiple repeats of the zones, it's going to be by the tissue that's sensitive. It's going to be basically, it is palpation based. Is that correct?
That's correct, yeah. Hirata had various rules about some rules about left and right. Oh, there you go, yeah. So, for example, what he would say is that if there is severe pathology going on in the torso region, so someone has hepatitis, for example, and there's a lot of pain and inflammation, then you should treat on the opposite side, on the torso. But as far as the arms and legs are concerned, he didn't talk about left and right. Manica does talk a little bit more about left and right, and I think in contemporary or complex HZT, I would talk a lot about left and right, just trying to use polarities of opposites. So if there's a problem on the right, then use the left. If there's a problem on the front, use the back. If there's a problem on the lower part of the body, use the upper zones or the upper regions. So those kind of selection principles. But yeah, in going back to your question, it's not a question just of saying, okay, I want to treat zone 6, so I'm going to do zone 6 on every single region. You just kind of look around at the zone 6s and see if they want treating. And your hands will tell you pretty quickly if there's a left-right imbalance on zone 6, or if there's a left-right imbalance. You know, you might want to treat the face, or you might not want to treat the face. So the head zone is an area that I like to treat quite often. The arms and legs, definitely. The torso, very much. The neck, from time to time. And the face, not so often. So that's kind of how I distinguish it. Thank you.
Thank you. Oran, is there any way for people to contact you? We have a question in the chat function saying that somebody would like to get in contact with you. Is there a way they can perhaps sign up to a newsletter or a website to contact you or anything like that?
Yeah, by all means. Maybe you could type my URL into the chat, or Bill, can you do that? orankivity.com. And if you just go to orankivity.com into the chat. Yeah. Or Charlene?
Yes, I'm doing it now.
Oh, okay. Charlene's typing it into the thing. So if you go to that's my landing page, and then there should be a sign up link there for you to sign up, and then you can get the newsletter, and I'll send out information about talks and different things to do with Ontaki. So I think it's Moxa in Motion newsletter. Okay. Yeah, that's a great question. Thank you.
Another question here for you. What size of bamboo would you advise to start with?
The standard size. So there are 3 sizes of bamboo. There's like mini bamboo, and then there's the standard one, and there's what are called super Ontaki. So the most useful one for you to use is the one that's kind of the kind of Model T Ford, which is the medium size, and that's pretty much good for everything. Now there are different advantages. Let me just go back to the screen share and the PowerPoint, and I think I had an image of the bamboo in one of the recent slides. Yeah, okay. So the one in the middle is the one that I use primarily, and it's just like the standard Ontaki. It's about 4 to 5 centimeters in length, and it's pretty much good for everything. But with time, over the last few years, people have developed 2 other sizes. So there's the mini Ontaki, which is the one on the left, and this one is basically used with children and with people who are a little bit sensitive, and also people who are scared of Ontaki coming towards their face. So when you're treating people with eye problems, you definitely want to work around the eyes. And if you bring like a really hot, flaming, like smoldering red hot brand towards someone's eyes, they might be intimidated, but they're much less intimidated by the mini Ontaki. Very often when I'm working on people's eyes, I might cover the eye that I'm working on with a cloth, like a very thin cloth or a tissue paper, and then work through that, because then even if they open their eyes, they can't see what's going on, and that feels less threatening. So the mini Ontaki is for kids who feel scared of like big flaming brands, and also working on the face. I think it can be a useful thing, though you can definitely work on the face with normal standard Ontaki. Now, the super Ontaki are double the length of the normal Ontaki. They're about the width of a practitioner's hand. That's the ideal length. And the idea of them is that you load one end only. So there's a plug at one end that gets hot, and that end gets hot, but the other end you can hold and it feels cool on your hand. So from a practitioner's point of view, this is a more comfortable Ontaki to use because it's got like a cold handle if you load it correctly. And not only that, but you can apply more leverage. If you're the kind of person who likes to do deep body work, then you've got more leverage to press hard with the super Ontaki. So those are the essential differences between the three. So if you just want to get started, then use the standard size. But if you want to have a selection, then JCM do a starter pack, which consists of one mini Ontaki, two standard Ontaki, and one super Ontaki, plus a little rod that you can use to compress the moxa in the tube, or to scrape out the burnt moxa once you're finished. So the starter pack's also a nice way to start. So you just choose which one you want. Thanks for that question. That's really helpful. Let me stop this screen share again.
Thank you very much. I just want to point out how many thank yous we're getting in the chat function as well. Lots and lots of people saying how interesting, inspiring and clear your presentation has been, and how useful the information is.
Oh, that's really good to hear, because you know, when you're teaching a live class, you can look at people's faces and you can see how people are reacting, and you can tailor the pace of what you're teaching. But when you're doing Zoom, and particularly when you're doing a PowerPoint, most of what you can see is the PowerPoint slides, and you see one or two faces of people in the background. And unfortunately today, the two faces I could see had switched their camera off, so I had no idea of seeing whether or not you guys were rocking or falling asleep. So that's really nice to hear. Thank you.
There's been, so many comments saying thank you, and how interesting and inspiring everybody has found it, and how the information has been very clear. So don't worry, you've done an amazing job there, Oran.
Great, thank you. Yeah, then, I mean, there's maybe one thing that I'd like to mention, which is, of course, the two books. Moxa in Motion is the first book, and that's now available at JCM Balance. And the next book is available at JCM Balance in the coming week or so. So just if you're interested in the book, the launch price for the Kindle version will be quite low. I think really like a special launch offer. So do let Charlene know that you're interested in buying it, and you should be able to get that ebook from the JCM Balance. And then if you're interested, I mean, if you're like me, you don't really like reading acupuncture books on Kindles, then you prefer the paperback. The paperback will be out on the 28th of this month, available from JCM Balance, and also, of course, on Amazon and in your local bookstore if you order it. So if you want to hang on for the paperback, just wait a couple more weeks on the 28th.
Thank you so much. Do you have time for one further question that we've received in the chat box?
Yes, I do, of course, with pleasure.
Thank you. So is the tapping used for the application?
Do you mean the tapping technique? Yeah, can the person who asked that question clarify it?
Yes.
Yeah, okay. There are all kinds of ways that you can apply Ontaki. You can apply it by rolling, just rolling with the heated side of the bamboo. And that's very useful when you're working on the back or on the leg. You can use percussive percussive strokes, like I call super knocking, which is just banging with the heated side of the bamboo. You can use the lip, and you can press deep into the joints with the lip of the bamboo. And I think in a way for Hirata zones, this is the most useful one. You can tap by bringing the lighted smoldering end down onto the skin and then removing it. So those are all ways to apply bamboo. And in the book, I basically have a kind of like a favorite 6 techniques that I think are very useful to use on the zones. Whereas in Moxa in Motion, I talked about quite a number of different techniques. But for Hirata therapy, I think tapping with the lighted end is probably the most important. Just getting that moxa and that light, that infrared light onto the skin is really super important. And also rolling or pressing with the side of the bamboo, just getting that pressure into the soft tissue is very useful. So all of those techniques, dokoi, they say here, everything can. Yeah, all of them can. So yeah.
Thank you. Just in closing, and to echo what you've already said, Oran, the Hirata Zone Therapy book and ebook will be available from JCM in the coming weeks, and I will of course send everybody who signed up to this event information about that as soon as it's available, along with a link to Oran's website. Thank you so much for everybody who's taken the time to join us today. And thank you so much to Oran for your talk. It's been incredibly interesting and clear. Thank you very much.
Thank you all very much. Thank you very much for attending. It's wonderful to see so many faces and familiar faces here as well. And a special thanks to Marek, who was a beta reader on the book. So yeah, thank you very much, Marek, and great to see you here.